Okay, thank you for joining. We're going to get started here. Thank you for joining. This is Dr. Fossum's Pet Care webinar, CBD, What Pet Owners Need to Know. That's going to be hosted by Dr. Terry Fossum. She's the CEO and co-founder of Dr. Fossum's Pet Care.
Great. Well, good morning, everyone, if you live on the West Coast, and good afternoon if you live elsewhere. It's a pleasure to have you guys here for this discussion of CBD. I'm gonna go through some slides. I recognize that there are primarily pet owners on the call, but there are a few veterinarians. So I will try to speak to both groups. And then when we finish, we have left plenty of time for a Q&A session at the end. So be thinking about your questions. And we'll go ahead and get started. So we're going to start with the very basics, and that is probably many of you have asked, what is the difference between hemp and marijuana? And the thing to know is that both hemp and marijuana come from the same plant, from the cannabis plant. The difference is how much THC they contain. So hemp, by definition, has cannabinoids. It may have hemp oil and other compounds, but what it has to have in the US, and this differs in other countries, but what it has to have is less than 0.3% THC, whereas marijuana can have, any orders of magnitude of THC above that. And in fact, probably everybody recognizes that today's marijuana is not yesterday's marijuana. It is getting stronger. But hemp is less than 0.3% THC by definition. So why is that important? Well, hemp is psychoactive. It is mood altering, but it's not psychotropic. It is not going to get your dog high, your cat high, or it's not going to get you high. Whereas marijuana is psychotropic, as we all know, the reason many people take it. Now, I don't, when I talk to veterinarians, we talk more about the endocannabinoid system, which is the system in our own bodies that actually, we have receptors for cannabinoids naturally. And so what we're doing when we're giving cannabinoids is we're supplementing a natural system in our body. And it can be fairly complicated. There are receptors, there are inhibitors, there are number of different things involved with this. We won't go through that, but it is a fairly complex process. Now, what I do think is dog lovers, we should all know, is that the receptors in a dog's brain for cannabinoids differs from that in the human brain. And one of the things that you will notice pretty clearly is look at the number of receptors that the dog has in their cerebellum and compare that to the number of receptors that humans have in their cerebellum. I think that is probably part of the reason that dogs are so much more sensitive to THC, is they have more receptors, and so they're more apt to become incoordinated, what we call ataxic, as veterinarians when they eat these substances, because they have more receptors in some parts of their brain than people do. Now, another term that I think is worthwhile for all of us to be familiar with, and that is the discussion of, do we have a full spectrum or a broad spectrum or a CBD isolate? So keep in mind that what we're doing is we're taking this plant and we are using various different methods to extract the cannabinoids that we're interested in. If the product says that it's full spectrum, that means that it's got terpenes in it, cannabinoids in it, flavonoids, and fatty acids. So it's got THC. When a product says it's a broad spectrum hemp product, what that means is they have left all those compounds in with the exception of THC. So a broad spectrum product should have 0 THC. And why is that important? Because less than 0.3% isn't going to hurt a dog. But so we chose to remove THC from our product, some of them, because if they're very palatable, my concern was that a dog might get into them and eat enough that in fact the THC could become problematic. We'll talk more about this later, but I honestly do not believe that you can overdose CBD, but you certainly, dogs can overdose THC. So we chose in some of our products to make it broad spectrum. Some of the products is not an issue. Dogs aren't going to eat the, say, the tincture, but a tasty chew, they might, if they got into the box, they might eat the whole box. In fact, I have to tell you that my 2-year-old Labrador did exactly that thing. I had about 100 chews on the counter in a jar. He managed to get the lid off and ate all of them. Luckily, they only had CBD, no THC, so he was fine. But that's a concern. So you do want to pay attention. Is it full spectrum or broad spectrum? And then the other term that you will see, not on veterinary products, but you may see out there, is CBD isolate. And what that means is that it has actually been purified to the point that everything else has been taken out, and it's just the CBD that's left. So there's no other cannabinoids. And keep in mind, there are 140 cannabinoids and counting. So lots of them out there, but if you have an isolate, it has been removed. So you're just getting the CBD. And the reason, and this is particularly for the veterinarians that are listening, the reason that is important is that when we look at the isolate and dosing, it's very much this bell-shaped curve, which means that there is an exact amount where you get the most benefit, and then it drops off if you give more. Now, that exact amount could be different from dog 1 to dog 2 or cat 1 to cat 2. So therein lies the issue with the isolate, in that we don't really know how to dose it in any specific animal. Interestingly enough, when you talk about the extracts, that is not the pharmacologic curve that we see. Instead, what we see with the extracts is that you give a certain amount, you may get a plateaued effect where you won't get any greater effect if you give more of the extract, but you also don't get a lesser effect. So giving more is not going to be harmful. Whereas with an isolate, it could be that you actually see a lesser effect. So for now, I am a firm believer that we should be using extracts in veterinary medicine. Now, the FDA has approved for human use a isolate. It's called it's a PDLX. You can see it here. It was approved for several seizure disorders, particularly in children. But again, it is an isolate. It's very expensive. It's not something that we're going to use in our dogs. But what it brings up is an important point. If it's approved by the FDA, then we can make claims, or the company can make claims. They can say it is to mitigate seizures, reduce seizures in children. Our products, because there are no products that have gone through the FDA as an isolate on the veterinary side, now all of ours are nutraceuticals, not drugs at this point. And so because of that, we cannot make claims, which means we can't say, you'll never see us advertise that our product is good for osteoarthritis, even though it is. And it's very good for what we call mobility issues, because mobility we can say, osteoarthritis we can't say, pain we can't say, we can say discomfort. So there are certain things that we're allowed to say and things we are not allowed to say. Those are called claims. And so just if you're wondering why we aren't more specific, sometimes in our advertising around these products, that would be the reason. Now, you might think, well, CBD is CBD, right? I can go online, buy it, it's going to be the same product. In this study, they took a bunch of products. They did this to human health, and they did this for products that were designated for pets, and just purchased them off the shelf and studied the amount of CBD they had in them, the amount of THC, and what they found is 70% of the products that are being sold online did not meet their label claims. Some of them had way more THC than they claimed to have, which could be dangerous. Some of them didn't have the amount of CBD that they claimed to have. And in fact, some did not have CBD at all in them. So you do have to be very careful what you purchase online, because it's kind of, honestly, it's the Wild West out there. So our concerns, and I think your concerns when you're looking for a product, is that what has happened is a lot of the companies that were in the human health space decided, oh, this will be just another revenue source. Let's slap a label on it and let's sell our product for pets. And what they haven't done is they haven't looked at how you would dose in that pet. And on the human side, as you guys all know, they don't deal with the size ranges that we deal with. So I can be dealing with a 2-pound miniature Yorkie in one case, and a 160-pound bull mastiff as the next case. Obviously, we can't dose like they do in people, where they'll oftentimes just say, take 1 ml twice a day. Can't do that given the weight variations that we see in the animals that we're treating. And they didn't think about, a lot of these companies didn't think about that. So I've had a number of clients come in with CBD that they've purchased, and they'll say, I'm not seeing an effect. What's going on? And I'll look at it, and honestly, I can't even figure out how much they're giving, because the company is not giving enough information that we can figure out if it's being dosed correctly. Most of the time, it is not being dosed appropriately. It's being dosed way, way too low. So stay away from these human companies that are slapping a pet label on the bottle, because you don't know what you're getting. We talked about unmet label claims. Again, I think one of the reasons CBD doesn't work in some dogs is people are not dosing it effectively. We'll talk about that more later. It should be dosed twice a day. The half-life of CBD is only 4.5 hours. So you're not going to get 24 hours of benefit if you dose it once a day. So we recommend dosing morning and night. The other issue that is a concern is that I'm going to show you guys what a certificate of authenticity is. What we want to make sure is that the product contains what it says it contains, and it doesn't contain things we don't want in there. So one of the things about the cannabis plant is that it is a soil remediator. It pulls everything out of the soil. In fact, they planted cannabis around Chernobyl to pull some of the radiation out of the soil. So if cannabis is planted, say, where maybe they've been growing tobacco and they've had heavy pesticide use or herbicides or even heavy metals in the soil, that is going to get pulled into the plant and into the flower. And that is what you're going to be feeding your dog, or that's what you're going to be giving yourself if you're taking this. So making sure that those are not present is really important. So what you want to do is you want to look at COA And one of the issues that's happening, and I don't know how we really get around this, again, buy from a reputable company, because there are false COAs being uploaded these days. And the other thing, as you guys well know, is that because CBD is not considered to be a drug, it's not, doesn't go through the FDA, instead it's a nutraceutical, it's not regulated. So people can, there are some things that people can say and get away with that would not typically be allowed. But it's actually, there are a lot of companies out there that are saying things that the FDA does not allow, even though this is a nutraceutical. For example, and we have this in a slide later on, but I'll just say it right now. We cannot tell people to add CBD to the food, because if we told you to do that, then our CBD or hemp would be a food additive, and CBD has not been approved as a food additive. So while it is better absorbed with a high-fat meal, we can't tell you to put it on the food. So, again, there's just regulations, and we try really hard to play by the book. Okay, so a certificate of analysis. This is actually from our company, but basically what it will show you is how much CBD is in the product per serving. It will tell you if there's any THC. So we have none. We have removed it. So this is a broad spectrum product. Now we do have other cannabinoids. We've elected to have CBG, which I'll speak to in a minute, in our product. And so you can see the total cannabinoids is greater than just the amount of CBD. And that's accounting for these other cannabinoids. And then it's also telling us what terpenes are in there. We'll talk more about that in a minute. The other thing that they're going to do is they're going to talk about whether there's chemicals left in there, any bacteria present, heavy metals present, mycotoxins or fungal elements present in the product. So it's really just a safety check. So this is a way, it's not a single page. They actually go through everything that they have tested for. So you can see the different terpenes that are in our product. Again, you can see if there's any chemical residues. You would want all these to be not detectable or below any level of sensitivity that they can find it at. And then again, it'll tell you exactly which cannabinoids are present. So for example, this is our product. We have CBD, but then we also have a significant amount of CBG in this product. So again, it should give you the exact amount of information that you need to figure out what is in that product. Now, one thing you will note if you go online is that the pricing is pretty variable between products. So things that you would want to ask or find out, maybe from your veterinarian if they're recommending a product, or if you go online, see if you can find this out. First off, I would recommend that you work with a company that has a veterinarian on staff, because you will likely have questions about dosing. You may have questions if your pet has an adverse event, and many people have questions about other drugs that their pet is on and whether or not they can give CBD along with it. So having a veterinarian that can answer those questions is important. We talked about the isolate versus the broad spectrum versus the full spectrum. I think either broad or full spectrum are fine for our pets. Again, if it's a really palatable product and it's full spectrum, be a little more careful, because your pet could OD on the CBD. Not going to happen again on the tincture, but could happen, say, on a really tasty chew, for example. The other thing to keep in mind is some of the products that are out there are really weak in concentration. So they'll, for example, we have products that may have, 3,000 milligrams in it, and some other products may have 300 milligrams in it in the bottle. So what you want to do is figure out how much you're paying per milligram, not how much you're paying per bottle, because if it's the less concentrated, you're going to have to give a lot more, and you're going to end up spending more money actually. So it may be cheaper to buy that cheaper bottle, but in the end, you're going to pay more because it's simply not concentrated enough. We do want to make sure that people are dosing by weight and dosing frequently enough for CBD to have an appropriate effect. We talked about the certificate of analysis. Make sure that the COA is on their website. Any legitimate seller of CBD will have a certificate of analysis, or what some people call a certificate of authenticity, on their website. The other thing that you might look for in the product is it certified? The National Animal Safety Council certified, called NASC is the abbreviation. They certify products and ensure that they've gone through the appropriate steps for good manufacturing, and that they do have COAs, that their third-party analyses have occurred. So we're not just testing our own products and saying, oh yeah, by the way, we have exactly what we say. We're actually sending that out and having a third-party analysis. That's all important. So see if you can get a product that has been certified by NASC or some other third-party certification. Just help ensure that you're getting what you're paying for and that it's going to be safe. So I mentioned everybody talks about CBD, but I think it's important that you guys, there are lots of other cannabinoids out there, and we're really only beginning to understand what they do. But what we are certainly finding over time is that certain cannabinoids work really well for one indication, and another cannabinoid might work better for a different indication. So for example, in humans, CBG is talked a lot about for inflammatory bowel disease. You won't see much about that in the veterinary literature, but CBG is the one that they think helps the most with that inflammatory condition. We added CBG to our product because of the paper that you see here, and that was that they found that adding CBG and CBD together was synergistic for neuropathic pain. So not just 2 + 2 = 4, but those two cannabinoids, 2 + 2 = 5 or 6. So we get more pain relief from that combination than you would expect to have either of them alone, no matter how you dosed it. And again, over time, we're going to find even more of these cannabinoids for very specific indications. You probably all noticed, if you bought CBD, that many times it has a very strong sort of grassy, earthy smell. That smell is coming from the terpenes that are in the product. And we prefer to leave some terpenes in the product because they actually do have benefit on their own. And you'll find them in lots. Like you'll find them in, most fruits out there, grapefruits, you name it. Any of the citrus fruits have terpenes in it. Pine needles have a type of terpene in them. Mango, thyme, citrus, lemongrass. You can see these different terpenes are found in different products. So fruits, whatever. So we like to leave them in, but that's why you're going to get that earthy smell that does put some people off. The more purified the extraction is, they may be taking these terpenes out, and then you'll have less odor, less flavor associated with it. So how are people using CBD today? Well, probably the number one indication is for mobility issues. So animals with chronic arthritis, pain seem to benefit greatly from CBD. Many people use it if their pets are anxious. We saw a lot of people asking about CBD for pets that have been adopted during the pandemic. And then when the owners were going back to work, these pets who were very used to having their owners home all day long, some of them had serious anxiety issues, separation anxiety, we call it. And CBD has helped many dogs with that. And then, and cats. And lastly, seizures. As I mentioned, the indication that's been approved by the FDA for people is for seizures. CBD is really good as an anti-epileptic for dogs and cats as well. And there are a couple studies out there that have shown efficacy, and we have a good idea of how to dose it. For the veterinarians who are on the call, I do believe that for anti-seizure activity, we have to dose CBD higher than we would for anxiety and maybe even for mobility. The study that was done used 2.5 milligrams per kilogram twice a day, but they said that a higher dose was probably indicated, and they saw, about a 30% reduction in seizures. So epilepsy, we're going to have to go higher than what we are going for, dose we're going to use for these other indications. Other things owners are interested in using CBD for are tumors. We have, and this is anecdotal at best, but we have had a number of owners that have told us that superficial tumors that they've been able to see on their dogs have gotten smaller or even gone away. Sometimes on CBD, not really sure exactly what is happening there, what the mechanism of action is, but interesting nonetheless. And then in people and in animals, it is being used for cancer, pain associated with cancer, particularly osteosarcoma, bone cancer in dogs. Now, in all fairness, a lot of the veterinarians are going to add more THC in if it's for, say, really severe pain, like bone tumor pain. They may actually use more THC. You're going to do that with your veterinarian. You're going to work with your veterinarian to figure out how much to give, but that can be really helpful for pain associated with bone cancer or other types of cancer. Inflammatory bowel disease is something that owners are interested. We just don't have really any good information on that in animals. And then postoperative pain is another one that people are interested in. Instead of coming home on, say, a non-steroidal or even, mainly going to be non-steroidals, they'd like to know if CBD will work for postoperative pain. Now, there are an increasing number of publications that are becoming available. I would still admit there's a dearth of information, of true peer-reviewed information, lots and lots of anecdotal information on safety and efficacy of CBD, but there's a fair amount of information out there on safety now, and more coming on efficacy. So this is one of the most recent papers that came out. This was a study where it came out of Mars, did this study, and they put dogs on CBD for 6 months and basically found that there were no important adverse events that occurred in these dogs, given even 6 months of CBD. We truly believe, and I mentioned this earlier, but I'll say it again, I don't think you can overdose CBD. I honestly do not believe that you could get enough just CBD in a dog to harm them. This was one of the earlier studies that looked at pharmacokinetic, safety, and clinical efficacy of CBD in dogs with osteoarthritis, and the study did show a benefit. They looked at 2 different doses, 2 mg per kg and 8 mg per kg, and settled on the lower dose of 2 mg per kg as being efficacious in dogs with osteoarthritis. This study was interesting because these were dogs in this study that had not responded to any other pain relief. So most of these dogs had been given nonsteroidals, gabapentin, and had not responded. So they added CBD to these other medications. And what they found is a high percentage of the dogs had pain relief, and many of them, the owners were able to either significantly reduce the amount of other drug, the non-steroidal anti-inflammatory they were getting, or in some cases eliminate it completely. And that's important because we all know that non-steroidal anti-inflammatories, while they can be really good analgesics in dogs, they can also be pretty harmful to the gut and to the kidneys. We see gastric ulcers from those drugs. We see sometimes even perforations of the GI tract. So we can see serious complications. And in fact, the reason that we started initially looking at CBD products is because I have a now almost 13-year-old Labrador that has an elbow issue that he was born with. For the veterinarians, he has elbow dysplasia and has pretty bad arthritis. And I put him on nonsteroidals for a while, but he really did not tolerate them. So I wanted to put him on CBD, and I wasn't really excited about the products that were on the market as I started doing my due diligence. So that's actually why we started Dr. Fossum's Pet Care. So you're probably asking, she said there aren't many serious side effects, and there aren't. But there are a few things that we do see on occasion. Some dogs, especially when they first get started on CBD, may develop diarrhea. I honestly do not think it's the CBD that's causing it. A lot of these products, such as our tincture, and most tinctures out there, are going to have an oil base, such as MCT oil in it or hemp seed oil. And that is probably what is giving these animals diarrhea, is the oil. So, and just a word, if you have a product that says it's hemp seed oil, that's the active, you're not getting cannabinoids. Hemp seed oil does not have cannabinoids in it, is not going to benefit your animal. Now, we'll put hemp seed oil in as an inactive ingredient, but we don't put it in as an active ingredient. So please be careful that you're not buying hemp seed oil as your active ingredient, because you're paying for nothing. Lethargy, some of these products will occasionally sedate animals. We don't see a lot of sedation, but we do see some. So lowering the dose for a short period of time will usually take care of that. And then some dogs will vomit. That's actually quite unusual. And then, if they become sedated, they can also develop uncoordination or become incoordinated. We call it ataxia, when they don't necessarily know where their feet are being placed. That's not very common with this product either, but it does happen. I would say rarely, but it does happen. When we spoke to safety, this is from 2019, but NASC is collecting adverse events. In fact, if you're a member of NASC, which we are, we have to report any adverse event to them. So for example, if an owner calls us and said that their dog vomited, even if we don't know that had anything to do with the CBD, we have to report that. And so they keep track of all that. With 49 million dogs that had been given CBD as of November 2019, they had 9 adverse events reported. 1 in a cat, 9 in dogs, 1 in a cat, and 3 in horses. And none of those were serious adverse events. No fatalities, no serious injuries, but vomiting, diarrhea, things of that nature. So again, when I say it's safe, we have lots of evidence that CBD is safe in dogs, cats, and horses. Now, one of the things we are concerned about is whether CBD will interact with other drugs that you might be on or your pet might be on. And drugs that undergo metabolism in the liver by cytochrome P450 may interact with CBD. And I have a list of those here. Valium, nonsteroidals. Again, we know that you can give CBD with nonsteroidals, but at least in people, they look out for that. Warfarin is probably the number one. There's anybody out there, you know, that is for clotting, and that drug does seem to interact with CBD. But for the most part, we're finding over time that most of these are not an issue. Now, the drugs that we get asked the most about are animals that are on gabapentin. Can you add CBD? The answer is yes. Carprofen, and other nonsteroidals, yes, you can add CBD. Again, what our hope would be that if you start them on both, that eventually you'll be able to lower or even completely take them off of the nonsteroidals. Keppra is for seizures. Yes, you can give CBD and Keppra. And again, what a lot of people have found is that you can lower the amount of Keppra when you add CBD in. I had my own Labrador on, he had back surgery not too long ago, and then he started seizuring. We worked him up for a brain tumor. He did not have that. He just had idiopathic epilepsy. So he was on Keppra and CBD for a short time, and then eventually we were able to take him off the Keppra completely. Phenobarb, same thing. You can give it in conjunction, but again, our hope would be that you could reduce it once you're also administering CBD. Our guidelines are that you start at a reasonable dose. Now, some people will say start at a low dose and increase it. The problem with that is at the lower dose, you may not see any effect, and then people think it doesn't work and they just quit using it. And in fact, they're just underdosing. So 2 milligrams per kilogram twice a day for the first 7 days is a good loading dose. And then you can decrease that dose to 1 milligram per kilogram after that time. What I will tell you is you're going to have to play around with the dose. Every dog is going to absorb the CBD that you give them orally differently. And in fact, they don't absorb it well to begin with. And so you may find, like I have kept my dog on 2 mg per kilogram twice a day. I didn't lower the dose, but you may find that you can go to 1 or maybe even lower, or you may have to go higher. So you will have to adjust the dose based on what you see in your animal. So dog or cat. And then again, give it twice a day. for the best effect. One of the things we do get asked by people, and Sean, who's on the call, takes a lot of these calls, so I'll let him add his 2 cents worth of what we're hearing from people. But one of the things that I found, because my Labrador is he's not a picky eater, will eat anything, but if you come at him, my husband's a veterinarian as well, and so he's all of his life he's lived with veterinarians. He does not like syringes. He doesn't like you to come after him with anything. But what I found is that if I broke a milk bone in half, they're so absorptive. They have so many holes in them. I can actually add a whole cc of product into that milk bone, and then he eats it readily. One of the things that Sean did with his dog is he initially put something really tasty, like you could do honey or syrup or something in the syringe, give them that for a day or two, and then start adding the CBD into it, and they'll just think it's a treat after that. I don't think it's the CBD most of these guys really object to. It's more, what are you trying to stick in my mouth kind of thing. So I don't know, Sean, do you want to add about the calls that we get and little tips and tricks?
Yeah, sure. It's one of the most common calls we get. And I do think that because we give it with an oral syringe, the pet owner loads the syringe up and then kind of runs at the dog and's like, come here, dog. You're going to get this syringe whether you like it or not. And so I actually developed like this very simple method by accident. We were doing a little kind of photo shoot or a video commercial type thing for Dr. Fossum. And my dog was the one that was getting all the CBD. So instead of giving her the CBD all the time, I didn't want to give her too much, as we talked about earlier. So I just started putting like a little bit of like syrup in the syringe because it had a similar color. And my dog started to associate the syringe with a kind of a tasty treat. And then after a while, I just changed out this. You can load it with the CBD oil and then the syrup, and then they still get it. And then eventually you can just basically give them the CBD and they just have that association that's very tasty. So that was like one trick that I found that was very helpful. Again, Dr. Fossum mentioned that CBD is best absorbed in a high fatty diet, but again, we can't tell you that it's okay to put your CBD on the dog food because then it becomes a food additive.
Right. But again, it's a good way to give it. So just a quick about our products. We are very careful about dosing these. So we do use a syringe. We don't want drops. I don't know if you guys have taken any drops, but drops are really hard to actually be specific about. And we wanted to make sure that people were giving a dose that has a chance to be effective. Again, our products are typically THC free. We do have very clear dosing instructions on the box that makes it very easy to figure out how much to give your dog. We are NASC certified. We have shelf life tested our products, and so we know that they are stable. Our products, our raw materials in our finished products are third party tested. We have the COA on the box, and there's a QR code, QR code on the box that will take you to the C of A if you want to take a look at that. And then we guarantee customer satisfaction. We don't have products returned very often, but if you try it and you don't see any benefit in the first 30 days or you're just not happy with it, you can return it for a full refund.
And we also, just to add in there, we also have the COAs. They're published on the website, and all you have to do at the bottom of the website in the footer, there's just a button that says Certificate of Analysis, and then go in there and it shows you all of our COAs.
And so these are our products. We have a very concentrated product for horses. And then we have products for, you can see the large dog product is highly concentrated. I think we are the most concentrated product on the market, which means that on a milligram per ml basis, we're actually one of the cheapest. And then we have a medium dog and a small dog, and then we have a product forecast. with, again, very specific dosing information for each of those product lines.
Just to add in on that real quick, Dr. Fossum. So we talked about earlier that if your dog, the side effects that we mentioned, the diarrhea specifically and vomiting, is we believe it's because of the MCT oil. And the reason why we have such a high concentrate product is because we can deliver the dose that we're looking to deliver in CBD, but without having a ton of carrier oil in it. So that's a benefit. So if you have another product that, that it's a 2-ounce container and you have, let's just say 400 milligrams, which is our cat tincture, and you have a 50-pound dog, you're going to have to give a lot of oil just to get that delivered dose of the 2 milligrams of CBD per kilogram of dog weight. So just wanted to add that little piece in there as well. So at Dr. Fossum's, we're really here for the pets and pet owners. We don't have a big agency that goes out and advertises all of our products for us, and so basically we don't spend a lot of money on Madison Avenue to try and get new customers. We really heavily rely on referrals from our existing customers. They see the benefit in their own dog, and they want that benefit to continue, and they want to see their friends' dogs get better as well, and family. So what we actually do at checkout, you can enter in the person who referred you, and you'll receive the person who referred you will get 25% of that order in store credit. So if I refer my friend, I will receive 25% of their order in store credit forever. So if it's a $100 order, I'll get $25 in store credit. And every time they order again, I'll continue to receive $25 of store credit. So if they order, if you get 4 people to do it, you effectively can get free products, and which is fantastic because our goal is to make these products affordable for everyone. This helps us grow our customer. This helps us get more customers and help more dogs. But at the same time, it helps our customers be able to afford it. And it's a great way for us to spread the word we'd rather reward our customers instead of paying a big agency to help us grow our company. So I just want to say thank you as being part of our community to help us grow it. And I hope you can take advantage of this. So again, at checkout, all they have to do is enter the name of your name basically, and you'll get 25% in store credit.
I think that is it. We are planning another webinar in October. We have not set a date for that, but it will be on cardiac function. And I would like to say that we actually have a number of other products on our website. If you're interested, we are coming out with a product for an anti-itch spray that has a really unique ingredient in it. So stay tuned. That will be out within the next month. And then we're also coming out with what I truly believe will be the best cardiac support supplement available. That will be coming out in the next couple months. And we do have a product out there for canine cognitive dysfunction called CogniCaps, which is very effective. And that is already being sold. So with that, I'll finish. And Sean, I think you had some questions that came in advance, and then we'll answer questions.
So we had a couple questions that were people who couldn't make the webinar who just asked them. So I'll run through these really quick, and I think we can spend a little time after. Sorry, I know we're kind of going over a little bit. The first question I have is, why won't my vet talk to me about CBD?
Why won't your vet talk? Good question. So veterinarians, the state licensing boards have, for the most part, declined to give guidance to veterinarians on CBD. So in some states have actually said veterinarians, this is rare, veterinarians can't talk about it or recommend products. Most states have eased up on that. But the reality is veterinarians just don't know what's okay, what's legal, what's not. And the concern is that they're going to recommend a product. The CBD isn't going to cause any issues, but maybe another product that the animal is on is. But because there's no guidance, they're just afraid that they might get a malpractice suit or something. And so it's a kind of a scary place for veterinarians right now. That is changing, and it will continue to change, but there are a lot of veterinarians who are afraid to talk about CBD at this point.
Yeah, and I'll just add in there, we've actually had a discussion with one of the veterinary state boards, and at the end of the discussion, a member of the state board stated, they basically said, we just can't continue to stick our head in the sand as it pertains to CBD. They haven't changed their guidance yet, but at least we're really trying to advocate to make sure that they're just providing clear guidance to veterinarians, because the alternative is the pet owner does not get educated about it, and they end up buying a gas station CBD, which doesn't help their dog, and they're spending money unnecessarily on a product that won't help. So the pet owners really rely on their veterinarians for guidance in this area, which is why it's so important that there's quality products out there. The next question was, when in my dog's disease should I start CBD?
Oh, that's a good question too. So when should you start CBD? So what we have found is that most people start CBD as the last resort. They've tried every other product. Their dogs either haven't benefited from it or haven't benefited as much as they'd like. And so then they'll try CBD. In a lot of those dogs, it helps pretty dramatically. I think it would be better if we started it earlier in the course of their disease, but we don't have a lot of studies out there yet looking at acute versus chronic use and or acute pain, chronic pain, things of that nature. But I think my impression is that in many cases we're just starting CBD as the last resort, and it really should be given earlier in the course of the disease.
Okay, thank you. And then the next one is, do different breeds react to CBD differently?
Oh, that's a tough one. You won't find this, to my knowledge, in any literature yet, but I will tell you, and this is just impression, it seems to us that there are a few breeds that may be more sensitive to CBD. And right now, I would tell you, I think those would probably be Pit Bulls, Staffordshires, maybe Bulldogs, and Australian Shepherds. But again, we don't know for sure, but those breeds, we've had more instances of sedation with it, which means to me they probably have more receptors for it.
Got it. Okay, and then where are you seeing the best? I think this might have been answered already, but it's a question that was asked beforehand. But where are you seeing the best results using CBD?
So the literature-wise, I would say the number one indication is probably seizures. No doubt that it's effective there. And again, there are studies in dogs. I think mobility is probably what it's used the most for, and certainly benefits a lot of dogs with discomfort. And then anxiety is actually, a lot of people use it for anxiety. And when you're using it for anxiety, we recommend that, let's say 4th of July. Don't start it on the 4th of July and think that it's going to make your dog less concerned about fireworks, that evening. What we would prefer that you do is start them 3, 4, 5 days in advance to make sure that they get blood levels. I do have a few people who tell me that they will give it and their dogs are almost instantly sedated, but that's not typically how it works. So give it a little bit longer, give it a chance to work. Don't just give it when you're taking your dog into the vet clinic or when you expect somebody's coming to your house and your dog is going to get anxious. Try and give it a few days before. I think you'll see a better effect. But those would be the 3 main indications: mobility, discomfort, and seizures.
Awesome. Okay, and one more, and then we're going to open it up for questions. And I know Jeannie and William already have questions, but this actually is from an existing customer. They go, my dog is on Cognicaps for canine cognitive dysfunction. Can I use CBD in conjunction with Cognicaps?
Oh, yeah. So Cognicaps, interesting because old dogs, Cognicaps, cognitive dysfunction, and old dogs, osteoarthritic pain, etc. So the two products do get used a lot in the same animal. There is no cannabinoids in the Cognicaps, so you're not double dosing them on cannabinoids. They're very different ingredients, but one for brain health, one for whole body.
We had one other that was asked. It's in the chat. I'm going to do my best. Dr. Fossum, thank you for your excellent presentation. I heard what you had to say about hemp oil. I wonder if the ingredients in this unnamed joint health supplement strike you as having anything beneficial for an 11-year-old English sheepdog's joint health. Glucosamine, HCI. I'm going to do my best here.
You don't have to read them. I know them. I got it up. So glucosamine, MSM, chondroitin sulfate. These are all products those are the common products that are recommended for osteoarthritis. And do they benefit? There are not great studies out there to say that any of those products are really beneficial in osteoarthritis. Quite honestly, and hemp oil is probably just a carrier. Again, if that's hemp seed oil, it's just a carrier. There's no activity there. I honestly would tell you, the only study out there that really showed significant benefit was for fish oil, salmon oil in dogs. That is definitely beneficial. So any of those products are beneficial for osteoarthritis. These probably, they're out there. The studies are equivocal at best, let's say. So I can't tell you it will benefit or it won't benefit, but it's very common ingredients.
Okay, great. I think Jeannie, you now you
have my mark.
Perfect.
I do.
Hi. First of all, with ordering, I wanted to know, do they need to put just your name or they need to put your link?
So both work. So if they click on the link and they order, then you get credit.
Mm-hmm.
But if they just put your name, you also get credit as well. So you can get credit two ways. So for example, if you were to take your link and post on Facebook and say, hey, I'm using these products and I found success with them, just wanted to share with my friends and family, and they click on that link, they don't have to share your name. But a lot of people it's either your name or your email address. Actually, both work. So whatever's easier for them. They have to enter 6 characters for the autocomplete to take hold.
Okay. And I just wanted to say that I joined this meeting today because I'm one of those veterinarians that doesn't know anything about CBD. and I do have people ask me about it. I've had people, I went on a house call once and they had given the dog CBD in hopes that it would calm it down for the blood draw because we'd had a lot of difficulty with it the year before. And it didn't seem to help the dog at all, but that was probably because it only had the one dose that morning.
Yeah. Jeannie, we do have, if you go on our website, we do have a webinar on CBD for veterinarians that goes into the mechanism of action and stuff, and some of the legal, issues behind it. And I would honestly tell you that legality, I think, is less of an issue now than even when we did that webinar. But if you want to look at that, that would give you some additional information. But thank you for joining us.
Yeah, thank you. And you're eligible for a free race continuing education credit on the veterinarian webinar as well.
Okay.
Awesome.
We have one up there for canine cognitive dysfunction too, Jeannie, same thing. You can get a free race credit.
Okay, great. Thank you.
Awesome. Thank you for the question.
We used to recommend Nutrix for cognitive dysfunction. Is your Cognicaps anything like that, or what?
So Cognicaps, what we did is we made it a combination of Western and Eastern therapeutics that have been shown to benefit brain health. So we have Chinese herbs that we have the standard things you'd have as well, like coenzyme Q10 and some of those others that are more kind of Western therapy, SAMe, for example. but we have 11 different ingredients in that product. And one of the things that bothers people the most when their dogs get CCD is a lot of these dogs become active at night. They pace at night, they keep their owners awake. The owners really hate that. And we found that in a large number of dogs, that goes away. We may not totally take them back to normal, but they'll start sleeping through the night again, which people really appreciate.
Somebody just announced Nutrix isn't on the market anymore.
Yeah. Well, give the Cognicaps a try, William, and see what you think. And we'd like to hear a comparison.
And we also did a study. It's a published study at this point, and we saw with Cognicaps, we saw an average improvement of 38% in dogs in 30 days.
Okay.
So there is some research behind it as well, and that's on our website in our blog section. There's a link to the actual public. There's a blog, and then there's a link to the published study in there.
Okay.
And we also have a survey on there. So if you have clients who want to take the survey to see what their dog's score is, if they have CCD, whether they have it and how severe it is, they can actually do that survey, and then they could do it again when they've been on it for 30 days or 60 days and see if there's improvement, if they want a more qualitative assessment.
Okay. That's for the Cognicaps or the?
That's for Cognicaps. Okay. That's for Cognicaps, and it's on our website.
Okay, great.
Yeah. Do we have any other questions?
Looks like we have answered everybody's questions. So info@drfossums.com. If you guys have questions, I'm happy to, Sean and I divide those up. If it's a medical question, you'll get an answer from me. If it's a customer service question, you'll get an answer from Sean, but you will get an answer. I think our customer service is really good. So don't hesitate to reach out. If you have questions, concerns, any way that we can help, we'd be happy to.
With that, thank you everyone for joining. We will be sending out the replay of this webinar. So if any other questions come up, you'll have our email address. And yeah, we're always here to help. We're here for the dogs and cats for that matter. So if anything that we can do to help, please let us know. And thank you very much for joining and being part of the Dr. Fossum's community.
Yes. Thank you, guys.